Is your baby taking their sweet time to arrive? Welcome to Baby Stuff, where we guide you through every stage of pregnancy, even when you've officially passed your due date. At 42 weeks pregnant, you're likely feeling a mix of anticipation and frustration, but rest assured, you're not alone, and your baby is still developing in important ways. Let's explore what's happening during this postterm stage and what you can expect next. Your baby at 42 weeks. Fully ready for the world. By 42 weeks, your baby is likely around 51 to 53 centimeters or 20 to 21 inches long and weighs approximately 3.9 to 4.5 kilograms or 8 to 10 pounds. Though every baby is unique, at this stage, your baby is fully developed and ready to be born, even if they're taking their time. While being overdue may feel concerning, only 5 to 10% of pregnancies actually reach this point. Postterm pregnancy is closely monitored to ensure both mother and baby remain healthy. Major developments at 42 weeks. Number 1. Continued weight gain. Your baby continues to gain weight, mostly from fat deposits that will help them regulate their body temperature after birth. Chubby cheeks, thicker thighs, and strong limbs mean your baby is well prepared for life outside the womb. Number 2. Skin and appearance changes. By now, the baby's lanugo, fine body hair, has disappeared, and their skin may look less wrinkled compared to earlier weeks. However, due to the longer stay in the amniotic sac, some babies might have peeling skin or look a little overcooked. This is perfectly normal and nothing to worry about. It's just from extended time in the womb. Number 3. Fully developed organs. Your baby's lungs, heart, and digestive system are fully functional and ready for life outside the womb. Once they take their first breath, their body will quickly adjust to breathing air and processing milk. Kidneys and liver are also developed and will begin working right after birth. Number 4. Brain and reflex maturity. The brain is still rapidly developing, creating new neural connections every second. This development continues well into early childhood. By now, your baby has developed strong reflexes like rooting, sucking, and grasping, key survival skills after birth. Number 5. Increased alertness. Babies born at 42 weeks often have a reputation for being more alert and engaged because of their extra time in the womb. Their vision, hearing, and sense of touch are well developed, and they can recognize familiar voices and sounds, especially yours. What you might experience this week. Number 1. Physical symptoms. Stronger Braxton Hicks contractions. You may notice more intense and frequent practice contractions as your body gets ready for labor. Pelvic pressure. With your baby fully engaged in the birth canal, expect pelvic discomfort and lower back pain. Increased fatigue. Carrying a fully developed baby is exhausting. Rest whenever possible. Cervical changes. Your healthcare provider may check for cervical dilation and effacement during prenatal visits. Number 2. Emotional challenges. Anxiety and impatience. It's normal to feel emotionally drained at this stage, especially if you've been hoping to meet your baby sooner. Excitement and anticipation. You're so close. Stay positive and lean on your support system. What your healthcare provider will do. By 42 weeks, your healthcare provider will likely schedule frequent checkups, sometimes every other day, to ensure you and your baby remain healthy. Common procedures include non-stress tests, NST, to monitor the baby's heart rate and movement patterns. Biophysical profile, BPP, an ultrasound that checks the baby's breathing, movements, muscle tone, and amniotic fluid levels. Membrane sweeping. Your provider may perform a membrane sweep to help stimulate labor naturally. Labor induction. If the baby still hasn't arrived, your provider may recommend induction methods, including medications like Pitocin, breaking your water manually, or using cervical ripening agents. Preparing for delivery. At 42 weeks, labor could begin at any moment, so make sure you're ready. Keep your hospital bag packed. Include essentials for yourself, your baby, and your partner. Stay in touch with your healthcare provider. Call if you experience regular contractions, water breaking, or notice any changes in the baby's movement. Stay calm and focused. Practice breathing exercises, relaxation techniques, and visualize a positive birth experience. Looking ahead, at 42 weeks pregnant, you're truly in the final stretch. While it may be challenging to wait, trust that your baby is still benefiting from every extra day of development. Your healthcare team will closely monitor both you and your baby to ensure a safe and healthy delivery. You're almost there. Your baby is ready, and soon you'll be holding them in your arms.